We are here today to do a full head-to-toe assessment, and we're going to start off with the thoracic. So I'm going to inspect the anterior and posterior lateral wall of the chest. Breathing is normal, no labored breathing. Respiratory effort is minimal. No use of accessory muscles or anything like that. So now we're going to palpate the chest wall for tenderness or lesions. And then I'm going to have you breathe in and out for expansion. Okay. And then we're going to do the posterior. Breathe in and out. Good. And we're going to palpate. You just hear resonant sounds. I'm going to have you lift your arm up. There you go. Do the lateral. Sorry if you're ticklish. I know.
Sure.
Sorry.
You're not going to do it on the other side too, are you?
Yeah, sorry. And then anterior. Okay. Now I'm going to listen. You can put your arms down. I'm going to listen anteriorly. Just take a deep breath for me. Again. 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 One more. Clear breath sounds throughout. And then deep breath. Another deep breath. Deep breath. Deep breath. One more. And one more. Okay. Clear breath sounds throughout. Okay, now we're gonna inspect the precordium and the chest area. We've got the aortic, pulmonic, herbs point, tricuspid, and mitral, and then the epigastric area. We're gonna palpate for any heaves or thrills, and then the PMI. No heaves or thrills present. And then we're going to listen. He's sitting up, so we're going to do the aortic. Pulmonic. Herbs. Tricuspid. and the mitral. Okay, I'm actually going to have you lay back on your back here.
On the floor?
Yep, we can lay on the floor. Sorry. We'll do the same thing. Aortic. Pulmonic. Herbs. Tricuspid. Mitral. I'm gonna have you lay on your left side. Yep. We'll do the same thing. Aortic. Pulmonic. Tricuspid. Good. Okay, you can sit back up. Listen to your carotid arteries real quick.
Your screen's still put on the floor.
Oh, that's okay. I'm just looking if you can look left for me. Turn. Okay, I'm also going to listen to. 1, 2, 3, hold your breath. Okay. Hold your breath again. Okay. Carotids are patent. I'm gonna feel for your pulses here. Your radial. Brachial. That's gonna be hard to feel, but your popliteal. And then I'm gonna just slip your dorsalis. Two plus pulses. I'm gonna go ahead and look at your skin. Nice and supple. Skin turgor is quick. Cap refill. It's less than 2. Okay, I'm gonna look at your scalp here.
Any fleas?
No.
That's good. Just got dipped.
Good. No lesions or papules, anything like that. Feel for your J. Can you open and close and open again and close? Good. Okay. I'm just gonna feel for your sinuses. Any pressure in the temporal sinuses?
No.
Maxillary
No.
sinuses. Okay. So neck. I'm gonna listen to your temporal arteries here. Got preocular lymph nodes, postocular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Now return your head and deep cervical. Cervical. No lymphadenopathy there. If you can, trachea there. And go ahead and swallow for me. Do it again. Okay. Easier said than done, right? Okay, I'm just gonna look at your eyelashes, sclera, white, no exudate, no redness, no erythema. Okay, I'm gonna take a peek in your eyes real quick. Go ahead and just face forward for me. Red light reflex present. Pupil is reactive to light and accommodate. You okay?
Mm-hmm. Reads bright.
I'm
But
gonna
the
go
good
ahead
one.
and take a peek in your ears real quick. Tympanic brain's pearly gray, a little wax buildup in that left ear. I'm gonna go ahead and look up your nose here. No erythema, moist. Open your mouth there and say ah. No exudate, no erythema, moist. Okay. All right. I think we're gonna go ahead and move down to the floor for abdominals. So if you want to go ahead and do that. Okay, now we're gonna inspect your abdomen here. Arms at your side. Hope you have an empty bladder.
We'll find out.
I'm gonna go ahead and listen. That sounds reactive. I'm gonna go ahead and listen to your aortic. Iliac. Your femoral, sorry, it's down here. Your renal arteries. Okay, just gonna percuss your abdomen here. And then percuss right up in your liver there. A little dull. And then your spleen. And then let me know if anything hurts. I'm just gonna palpate.
Yeah. Ouch, dig it in my ribs.
Sorry.
It's okay.
So if you can take a deep breath for me. So it's Murphy's sign. Any pain there?
Mm-mm.
And then push there. Any pain?
No. Just odd feeling.
Like Bernie's point. And then, so I'm going to take your knee up here. We're going to do the iliopsis muscle test. Both knees, actually. And then, any pain?
No.
Okay. And then, the one laid down. Sorry. And then your knee bent. Internally rotate. Any pain on that side?
No.
And I'm going to palpate your aortic pulse here. Okay, I'm going to have you sit up for a second. Sit you up. And I'm just going to palpate on the back here. Let me know if you feel anything.
I can feel that.
Any pain?
Oh no.
Okay. Again? Any pain?
No.
Okay. I'll have you sit back up here and we'll do some reflexes. Okay, we're gonna do some range of motions here. So I'm gonna have you flex your neck, which would be down, and then extending, so lean it back, and then from each side to side, and then rotation. Rotate all around. Good. Any pain or limitation with that?
Mm-mm.
Okay. Your shoulder, we're gonna do some adduction, so you're gonna lift this way, out, okay, and down. And then internal rotation and external rotation. Okay. Same with the other arm. So up and down and internal and external. Good. And then we're gonna do elbow flexion. So we're gonna do flexion. Bring your elbows all the way up to your shoulders. Perfect. And then extension. And then supination and pronation. Good. So your wrist, we're gonna do flexion and extension, and then ulnar deviation, so out, and yeah, radial is in. So, no, there. So, out and in. Okay, just with your wrist. Good. Fingers, flexion, so down, and extension is back up, and then abduction is spreading them out, and abduction is putting back together. Perfect. Okay. I'm gonna have you stand here. We're gonna do your hip. So we're gonna, for internally rotation, you're gonna turn your foot in. There you go. Perfect. External, you're gonna rotate it out. Great. Flexion, you're gonna go forward. And extension, you're gonna go all the way back. There, perfect, thank you. And do it with the other leg. So, in, per. Swing out and back up. Perfect. Okay. Knee, so I'll have you sit down again. Sorry.
It's okay.
So knee, your flexion right now is just bending. Extension, out. Perfect. I got it. Thank you. And then ankle, We're gonna do plantar, which is toes down, so point your foot down. Perfect. And then flexions back up, dorsal flexions back up. And then inversion is your pinky toe down, so turn your foot out. And then eversion is your big toe in. Perfect. Now next leg. Yep. Flexion, inversion, and eversion. Yep. You got it. And so we'll stand up one more time to do the vertebral column. So we're going to do flexion, which is bending over, and extension, which is bending back. And then you're going to do rotation. Perfect. And then lateral. Perfect. Okay. Now we're going to do the acromial clavicular joint crossover.
Mm-hmm.
So you're going to cross your arm across your body. Okay? Any pain there?
Nope.
And next arm?
The screen is.
Oh,
Sorry. Just that.
sorry. Perfect. And then we're going to do the Apley scratch test. So reach your right arm. Yes. And then back under. Okay. And do it with the next one. To the right. Yep. And then under. Good. Have you been practicing?
I had a good teacher.
And then the near impingement, we're going to lift our arm all the way up. Popping or anything.
Mm-hmm.
Okay. And the next arm. A little pop there.
A little pop.
Okay. And then back down. Good. And then we're going to do the Hawkins. So we're going to bend 90 degrees and push down. Anything?
No.
Okay. And then bend 90 degrees and down. Good strength. Okay. Then we're going to do the external rotation lag test. So you're going to bend 90 degrees up and push back. Anything there?
Nope.
Okay. And then 90 degrees up and push back. Nope. Okay. Then we're going to do the drop arm test. So I'm going to lift one arm and just. Okay. Okay. And then we're going to do the empty can test. So you're going to give a can of soda out to the side and dump it. Good job.
Shouldn't drink soda.
Then we're going to do the Finkelstein test. So you'll put your thumbs inside your fingers and point down. And do you have any wrist pain when you do that? Just keep staying down. Any wrist pain?
Mm-mm.
Okay. And then we're going to do the to kneel test. So I'm going to tap on your medial nerve here.